All right, Bengals fans. I mean, really good performance by Jake Browning. I mean, are you kidding me? Really impressive. But you got Joe Burrow on the sidelines in a sling, and you can clearly see he's in an ace wrap. He's in a splint. Just had surgery on his wrist. Now, when we were watching Joe Burrow, he's got his hand. He's trying to grip the ball as he's trying to come back in the game. You know, whether it's controversy, whether he had the wrist injury before or after, NFL's sorting through all of that stuff. Regardless, he couldn't grip the ball after the re-injury of his wrist. And what are we concerned about? Well, there's 8 bones in the wrist between the long forearm bones, your radius, your ulna, and there's 8 bones in the wrist here. You got the scaphoid lunate, and these are really important. And it looks like he separated his SL joint. So what happens is these 2 bones splay apart. They move apart, and that just makes it super hard to grip. The grip strength is tough. It's a problem to hold the ball. It's a problem to do this and move the wrist and throw and flex and extend the wrist. So I got to tell you, Joe Burrow had a state-of-the-art procedure from what I understand. He had a reconstruction of this joint, probably with something that Arthrex helped devise, which is the internal brace. We actually use anchors plus polyester super strong tape suture here. It's really strong stuff. Plus maybe a cadaver ligament or his own tissue. I don't know. But the problem is you got to stabilize this joint because it's under so much stress. There's a lot of force transmitted from this bone, the radius, all the way across the wrist, especially in a throwing quarterback. So I know he had a really state-of-the-art procedure, done extremely well. But thank you to Arthrex for helping us devise the SL ligament reconstruction with the internal brace, plus cadaver graft, plus just reconstructing this with really good anchors. Joe, you're going to be back, I think, and do really well next season. These can be really tough injuries in a throwing quarterback to come back with, but our technological advances in orthopedics have helped us immensely treat an injury like this in someone where this could potentially be career ending, but not anymore. Joe Burrow, we'll see you next year.